initial process of doing the intake. Um, People are going to bring them in boxes. People are going to bring them in animal carriers, pet taxis. Some people are going to bring them zip corded together, which is nothing that we recommend, obviously, but we've seen birds with taped legs, taped wings. It's what they bring us in. We need to, first and foremost, get that bird into a comfortable place. So if it is tethered or zip tied, we immediately remove those and get it into our own box. If it's already in a box, the bird goes somewhere quiet and out of the way of the human activity. It needs to be not around us discussing this with the finders. Someone calls, it's so important that they know that you need to have it contained so that it doesn't suddenly get out. We've had birds get out of their, restraints and be flapping around the car, and people have to pull over. It's dangerous. Just have it in a box. So the first thing that you're going to want to do is get the bird to a comfortable place. Okay, check. And even if it's being left in the pet taxi, I always bring people into the exam area. We set the pet taxi up on a table. You can put or the floor, you can put a blanket over it to keep it even calmer. But then if you're going to be discussing things, it really should be away from the bird itself. So
I'm gonna come around and record you guys.
we don't have anything saying for office use only on these, so I'm going to mark the places that the person will fill out, and then everything else above and below those X's. So we want to know who they are, how do we contact them, where was the bird found as close as possible. That can be an intersection of two roads. Most people know where that closest location is, when it was found, and if they offered anything, food or water. No one should be offering food or water, but when people get the bird, they oftentimes, even before they call us, will do so. Find out what it was they offered it so that we can know what's going on. If we see something wedged in the back of the mouth or something like that, we know what it is, or it can help us to sort of go right for it. If someone's offered food or water, it's something that we want to check right away when we get the bird out for the exam. And then everything else is for office use only. So case number should be assigned to the bird before you do anything. Here's the case book. Case number, the first two numbers are going to be the year. So right now we'd still be in 20. And then the sequential order. We used to separate eagles from non-eagles. We don't do that anymore. It's just what bird number are you walking through the door. So if 3 people are coming through the door, you mark those birds in the order that you plan to examine them, and you assign those numbers. But we cannot have any blank spaces in this book. That's a big no-no. We have to report these at the end of the year, each and every year. And anyone who comes into our clinic from DNR or U.S. Fish and Wildlife Service, if they want to see our records and they're incomplete, it's a huge, huge no-no. So first thing, give it a number. The other thing is identifying the species. If you do not know what the species is, it's okay. It's just like, this is something that comes with practice. We've got the big 5, our red tails, kestrels, screech, great horn, and barred owls. Those are the big 5 in Iowa. Those are going to be about 85% of the caseload we take on. The other ones are going to be bald eagles. So it's okay if you cannot identify strange ones. Just make sure it has a number and we can work out that. I do recommend people go on to read books or go online and look at photos on All About Birds. Just type in a species. They got great pictures. We have plenty of books here in the clinic. So case number, check. The date that you in fact received it, not the date found. The date that it came into our door, that's the other one that needs to be filled out immediately. So this is housekeeping 101. It must be the first step, and it must be done every single time a bird comes through our door. And that includes songbirds. Okay, so bird comes out. 2 pieces of equipment that you should be using: gloves and goggles. Every time, gloves and goggles. If we don't have any, we need to get more, but Make sure you're wearing gloves when this is happening. If you suspect an injury, the bird's standing up, but one of its wings is drooping, you still want to get the feet secured. I know that we want to protect the wing that is potentially injured, but the broken wing is not a danger to you. The feet are. So make sure those feet are secured before you attempt to secure any potential injuries. We do want to limit the flapping that's going on, but we want people to be safe. That's more important to us, is your safety. So eyeglasses and leather gloves must be worn when handling any and all of these. For eagles, we have a vest. Wear the vest. No one needs to be brave or think that I can do this or prove that they can do it without the vest. Just wear it, because an eagle is not fun to remove from your skin. I can speak from experience. So the head to tail examination must happen every time, head to tail. It can happen more quickly as you become more proficient, but we don't want to miss something and have it go untreated for a week before someone else comes along and finds it. If you do the examination and... All right, there is a lot of redundancy in the paperwork, but it's good. If the paper gets separated from the other portions, you'll have it written on each sheet. The case number is going to be the most important thing. That way each and every one has a unique identifier, and we can mix up paperwork but get it back together in appropriate fashion that way. So, weight. And Kim, behind you, that is a scale that's much better for large birds. We have a digital one used to weigh babies. I believe it was donated to us. But we can use the more analog version of weights. It still is pretty accurate. So make sure we get a weight on the birds. And I think a lot of times people will ask the question of, it's really dumpy, I really want to give it a shot. I think for starts, while we're coming up with protocols, it's one of those situations where just get the weight. Let's get weights on all the birds because that's going to be important for the keel scoring. So being able to identify it isn't going to necessarily change the treatment that we give to it. It's just going to change a couple of points on our examination sheet, namely the crop. Owls lack one, so you can put an NA or just a cross through it to indicate that there is no crop that should be present. And this is also something where the eyes and ears are going to be a little different than your diurnal species. The first thing on here, condition on presentation. There's an S by this group of questions. It means subjective. Everyone's going to have a little different opinion about what is good, what is fair, what is poor, what is excellent. I always tend to go to the lower end. If a bird's on my table, it's already a strike against them for me. So I usually have mine on the fair to poor. But we do get birds that are just like kind of stunned. If you feel like this is something in a couple hours, this bird's going to be a whole different animal, you can put good, as long as you're saying in the next line some of the explanation why you're choosing that. It's good, but it's quiet, alert, responsive, QAR. And all of these abbreviations, if we don't have a list, we'll come up with one. But the primary problem you would put would probably be central nervous system damage. So that could be brain or spine. And those are the two things that we consider CNS. But if you think that we got CNS issues, I'm going to tell you right now, that's serious. In fact, that should be the primary thing that you're going to be taking care of. If you got central nervous system damage, that's priority one. We need to start treating that bird for that immediately. You can do a wing wrap, that's great. We got some wound care, get that together, but we need to make sure that that bird, has its central nervous system damage, dealt with. And it could mean euthanasia. Euthanasia is a part of it. If we have severe head trauma, or you feel like this bird is in incredibly sore shape, then it may be a decision that euthanasia is going to be the best option. And that's going to be for the licensed rehabber, the senior staff, to make those decisions until we get people more comfortable. We like what you're finding, what you're seeing. We have people here with actual human medicine experience. Please be very, very descriptive and let us know what you're seeing. But as far as the euthanasia process, you should always either be with someone who's been cleared for euthanasia and the anesthesia machine, or make it as comfortable as you possibly can until the next staff member can get in. If someone's available and you think that this bird's really suffering, we can try to get someone that day to come in and take a look. But signs of that, we'll have birds that the pupils are completely dilated, they're tracking back and forth. There are lots of different causes for this tracking motion, but if you see a bird tracking, there's probably something going on in the central nervous system. We're going to be looking for any sort of eye injuries, blood anywhere on the head. Right now, what I'd like to do is move to the eyes. And everyone should be able to easily open the eyelids. When you get a bird, though, the eye should be very turgid. It should be, it should maintain its spherical form, at least from what we can see. But what you're looking for is there blood in there? And we use pen lights. You can find one. Pen lights to test. We're looking to see, does it respond to light? Sometimes they will, sometimes they won't, especially when we find really shocky birds. That reflex or that response, it's muted in many cases. If you get some sort of response, you can say a little PLR, or good PLR. If the pupil immediately closes upon light introduced to it, that's good PLR, and that's a good sign. It's a good sign, it's just like we like reflexes and responses like that to be intact. But you can say it's crusty, there's goobers in the eye. Whatever you have to say, it's leading us to know what the treatment plan is. Goobery eyes that look infected, we put TAB in. If I err on the side of not using dexamethasone. We have TAB with and without dex. You don't know, just use without. Dex will actually hinder any sort of healing of ulcers or wounds on the eye, so just err on the side of safety. Go and make sure it doesn't have any sort of medication that ends with an ONE. ON means steroids, so don't use anything with steroids if you don't know that the bird has or does not have an injury, a cut to the actual eye. Next on the list, and this is also a fun one, with owls especially, the ear tufts. If you do have someone, right now we're keeping our distance, but if you do have someone, this is a great way to tell people how not to find the ears. These ear tufts, they could be up, they could be back, but they're just really cool things that some owls have. So it's just something for folks to know if they're educating people. The ears, owls are really easy. Hawks and eagles are not. The owls will have a satellite sort of shaped facial disc of feathers. You look at the feathers, they're very different. They look like little TV antennas. They're catching sound and other mechanical waves. And it's funneling the sound back. And you can see there's a crescent moon or semicircle feather construction. And if you were to just gently push forward, you'll feel an actual plate of feathers, and it's attached to skin. The ears are almost invariably hidden right under that black circle. That's the demarcation between the facial disc feathers and the rest of those head feathers. And it's an easy way to find those ears. Hawks and eagles, it's a little tougher. You just have to have the experience to know you go down a little and back a little. You can feel the opening to the ear canal there if you gently feel, and that can be a good looker. But in other cases, you just have to do a lot of searching. I see a lot of people fumbling over this. So for owls, it should really be easy. But for hawks and eagles, I understand it just takes a little practice. Remember, the ears are behind and a little lower than the eyes on the diurnal birds. We're looking inside to see if there's any discoloration. Bruising color does happen inside the ear cavity here. And we can also see with eye injuries, you'll often see some purple and reddish coloring to the back of the eye socket. It should be pink, pale pink to pale purple, and there will be flakiness sometimes. The skin will be flaking. That's perfectly normal. They get rid of, exfoliate or excrete, whatever you want to call it, same kind of materials we do out of our ears, and it just shouldn't be all blocked up. This is also a place, especially during fly season, where you'll find maggots. Those are things that should be removed pretty immediately if you can feel comfortable. Otherwise, just note it. So blood, discoloration, or parasites, anything that doesn't belong there. Pennies, chocolate chips, these words. Check both ears. Don't get tunnel visioned. If you see one eye that looks bad and the other one looks good, don't skip the ear on the good side. Always look both sides. We want a full picture. All right. Next is going to be the cere and beak. The cere is the fleshy portion that extends from the nares, the nostril openings, back to the actual skull itself. And this should be intact. It shouldn't have really a lot of wounds, a little scrape here and there. It's nothing to start a treatment protocol for, but it is something you want to mention. It gives us an idea of what may have happened. A lot of these birds are hit on roadsides or sucked to the ground by a large vehicle passing under them, and they just biff it. It could just be a little road rash. You can put some TAB ointment on that, but make sure it's ophthalmic TAB ointment. We don't want any of the other stuff near the eyes. It should be something you can use in the eye if you put it on the cere. It's too close. The beak, for my bird, the great horns, it should be pure black. For things like barred owls or screech owls, it's going to be more translucent. It's going to be yellow on your barred owls. It's going to be a grayish yellow on the screech. The important thing is not the color as much as, are there any cracks? Does it look like it's broken? You're inspecting that. And then you open the mouth. You're looking for blood in the oral cavity. That's going to be a sign that we may have some internal injuries, whether from the head or from the glottis or esophagus. If you see blood in the mouth and it hasn't been given food, then there may be something wrong. There should be two holes that you can easily see. The first one is on the top of the mouth, called the choana. It's not listed, but that should be free from blood. It should not be obstructed. This is most likely where you're going to find things like ground hamburger wedged into the bird if they've been fed, but that should be clean and clear. And then right behind the forked tongue, and if I can do this easily,
Yes.
right behind the forked tongue,
Pulling it out.
you'll see another hole. It's a hole that can be closed by their own muscle actions, but that is the glottal opening, and it connects up with that upper choana, and that's how they breathe, with their mouths closed. And then in the back of the mouth, you're going to see anything from the very back, a yellowish white coloring. That's normal. That's the opening to the esophagus. And the mouth should be pink. If it's pale, it's probably dehydrated or has lost some blood. You can look for bruising. You'll also look for things that look like cottage cheese chunks. Cottage cheese chunks, it's probably a parasitic infection, but if you see anything like that, note it. Moving on, the crop. Everyone here is owls, so should we move on from that? Okay. You have an owl, just put N-A. N-A for crop. Not applicable. At least I don't know of any owls that have crops. Go straight down to their proventriculus.
You're gonna shake for a little bit.
Now we go to pectorals. Okay, the chest muscle, the main flight muscles. This is where your alcohol is going to be important. The best way to do this is to feel right where the keel bone, the boat-shaped bone starts, and go with your other finger, your thumb, and then alcohol on both sides.
Can I get that? Some duty man?
Pushing the feathers aside, you should have clean and easy access to not only the keel bone, which should look white under the skin, but also the fleshy muscle, the pectorals, to either side of that keel bone. This is probably where most of the uncertainty comes. How thin or how not, or how healthy is this bird's pectoral region? It depends on the time of year. It depends on the type of bird. Usually, we're looking for, on a scale of 1 to 5, 1 being completely emaciated, meaning you can feel nothing but hard bone, all the way up to 5, where you will actually find cleavage. And you will find birds that are that healthy. I usually find it on the great horns and the red tails, and I don't know if that just makes them more efficient hunters or what, but they can come in pretty hefty. I rarely see 5s. Anything between 3 and 4 is nothing that we need to worry about. Now, how do we score it? That's going to be where we need some sort of a chart or figure. We use Keel Score KS. We use a 1 through 5. Some people use 0 through 3 and have, we have half step increments. If you want to get fancy and put like 3.25, wow, that's amazing. I just go with half steps. So 1, emaciated, to 5, cleavage. Feeling along the backbone, there aren't any obvious shifts in that backbone. There shouldn't be any like hard turns left or hard turns right. There shouldn't be any real hard turns in or up. Now, indications of a spinal fracture or a spinal injury, probably going to be the bird's not standing and it doesn't have any reflex in its extremities, which you can test with a simple pinch test. And the pinch test, it really involves, you can easily pinch gently on the skin, but you can go for deep pain sensation by using a pair of hemostats and squeezing firmly, not to the point where you're going to crack the nail, but squeeze firmly where the nail meets the nail bed, the tissue. Squeeze on the nail there. The bird should have a reflex. It hurts. And if they have deep pain sensation, they're going to have the shallow stuff too. So the deep pain sensation is what you're really wanting to know. And that's a good indication that we probably do have something going on, but at least they can still feel down there. Those are birds that you just set up as comfortably as you can in the roll towel method that we do. We'll go over that in the protocols, but the spine, just look for hard shifts. If you're not sure, just put a question mark. Air sacs. This is the other one. You won't see air sacs unless they're injured. An air sac that's ruptured will release air subcutaneously. You will see actual bubbles of air under the skin in very key places, namely in the groin area, the inguinal area where we will give fluids, and the wing pit area where we also give fluids. Fluids and injured air sacs do not mix well. So if we've got injuries to the air sacs, then the bird's probably been down a short period of time because that air will recede, it will escape. I don't know by what method that is, but they do heal themselves. Air sacs will heal and the air will dissipate. So if you've got blown up ones, probably just got hit last night. So at that point, what you're really looking for is going to be giving fluids orally, not subcutaneously anywhere there's air sac damage, because water and the air sacs do not mix either. So that's a good key note. But if you have an area where the bird doesn't have air sac damage, like let's say we're all puffy down here in the legs, but the wings are nice and smooth, you can still give there. There are 4 sets of 2 air sacs in the body, and then another one right here in the neck, the cervical air sac. So it's one of those things where they aren't, all connected in a fashion that's going to not allow you to get fluids in one good area and not the other. The important thing is that you do not put a needle anywhere near puffy skin. So if you haven't given fluids and it looks like you got air sac damage. If you're not sure, don't stick a needle in a bird you're not sure on. Just wait till the next person, and if we find a consistent message that we're not sure about air sac damage, we'll do a training on it. Next we go to shoulder, the clavicles. Right at the tip, the top point of the keel bone. If you veer off left and right, you'll feel this. That is bone. It's the wishbone. And you should be able to give gentle pressure from the tip of the keel all the way to the shoulder without popping or a lot of give. If you get popping or give, or the bird flinches, it writhes in pain, you may have some sort of disconnection or fracture in that bone. Actually not all that serious, in my opinion. That's something that can easily be wrapped or, self-limited. The important ones are the coracoids. That's the major connection between the shoulder and the keel bone, the body itself. And X-ray is the best tool to determine if you have a coracoid fracture or not. But clavicles, those are easy. You can see and we rarely have clavicle breaks. So if the bird's not flying, I'd rather go to the shoulder or an actual wing bone, which we're going to move on to next. Below the clavicle, and this is where we're going to want to use alcohol. The humerus bone that attaches at the shoulder to the elbow, those are the two. It's the human body in bird form, pretty much. Some bones more fused than others. But what you're going to do is you got a bird on the table, and someone is holding, hopefully. You're not doing this, having to restrain it with a zip cord or whatever. But someone's holding. Every time you go to inspect a bone, inspect one bone at a time. That means that I don't know if the humerus is broken, so none of this to inspect the humerus. The humerus can be inspected without wing extension by grabbing at the shoulder area and grabbing at the elbow area and slowly moving your finger. I oftentimes close my eyes so that they don't get in the way of what I'm actually feeling. I think eyes can be very deceptive, but you feel your way up, and if I'm holding both joints securely, there should be no popping or movement between my fingers. If there is, you got something broken. Shoulder injuries are harder to really detect, but my humerus is solid all the way through. It gives a gentle curve at the end right into the elbow joint. Once I've inspected the humerus, it is now safe to do this. I'm not going to break or make something go open. Now I want to inspect the elbow and the wrist and the bones between. The radius is the one, and I don't know my terms, but it's the smaller one on top. So it's the bone, if you were extending the wing, the one that's closest to the head. It doesn't matter. You just want to know that neither of these two bones, the radius or the ulna, grabbing the joints, you're just simply gently pressing one bone at a time. Don't try to do this. You're not going to get anything. You probably will cause a lot of pain. If possible, this should be done under anesthesia, but if you're not trained on it, you can't do anesthesia on the bird. You have to do the best you can by securing the wing and feeling one bone at a time. If nothing moves or pops, you're probably safe to move on to the wrist And the fingers, the metacarpals. So from wrist to fingers, you can look at your diagram. You're feeling for the same thing. The biggest, the biggest bone, that major metacarpal there, there are two fused bones. You're feeling treated as if it's two separate bones, because a break in one place could, not be found if you treat it all as one. So test both sides to see if you've got any shifts. And then what you can do if you don't feel anything, from shoulder to tip of wing. After that, I give a gentle squirt along those bones with alcohol. Now, what would be the problem, do you think, if you started squirting alcohol onto a bird whose bones you haven't inspected yet? You may have an open wound. You're just dousing it with alcohol. This is a little chilly, but if you feel like there's no crustiness, no open wounds, just a gentle helping of it. This is also going to help you get to the area where you would likely give fluids. So it's going to be like a pre-step in giving fluids. Now, has everyone got their wing alcoholed up? If you don't, make sure at least one of it is, because we're going to be giving fluids into these birds, and I'd like you to see the wing pit. When you throw alcohol on the skin, it's not only preparing you for the blood draws and the administering of fluids, it's also going to show you if there's discoloration. My bird, even though it does not have a break, has green bruising on it. So that could have been caused probably by me trying to get blood, but that could be caused by lots of different things. It could be the single cause that this bird was able to be caught in the first place, was just sore muscles that it couldn't use comfortably, in which case we're obviously going to treat with pain medication, but that's a great case. Just got some sore muscles, okay, we'll get you out of here, lickety split, hopefully. But this is all after you've inspected for open wounds or open fractures. The wing pit in their bird, it's going to be where it's our armpit on the bird, though. Exact same place. It's actually going to look like an armpit with an extreme wing. I always think it looks like a dog's armpit. They've got that kind of flap of skin there. So this is the spot where you would give fluids if there was no bubbling. When there's air sac damage, oftentimes the air is escaped into little micro. It's like a phyllo dough. Their skin. It's very, very thin, but multiple layers of skin, and it'll get trapped as bubbles that will actually crinkle like crepe paper does when you press on it. So that's a good sign that you've got something wrong. All right. So giving fluids, and we'll go over this in more detail because I definitely took that cap off in an inappropriate way. But what we're wanting to do is go just under the skin, and the best way to know that you're not in muscle, other than the bird not flinching, which sometimes they won't if they're shocky. The best way to know is that you can still see the bevel, that sliced opening to the needle. You should still see that bevel opening when you have the needle completely into the skin. And how I usually do that is by putting it in and then wiggling it up. I can see the opening, and then when you give the fluids, you should see an immediate bubble. If you don't see an immediate bubble, you've gone through the wing or you've gone into something you shouldn't have. The reason that they don't prefer this over giving in the groin area is that this is much more risky, because if the bird jostles in the wrong way, that needle's going straight into an air sac, and you may introduce fluids where the only fluid that belongs there would be air. So yeah, it's preferable not to try to recap any of these, but we re-sterilize these, so you gotta uncap this. But recap with one hand. Don't be doing this, putting needles and caps back on. I've seen so many people stab themselves. And when you're uncapping, you just simply with one hand, if it wasn't wet already, but it would come off the tip, um, and then recap one-handed. This is just keep you safe and try to help people from wanting to do this work. I've stabbed myself so many times with needles. It's just not necessary. So anyway, once the needle's done, throw it in the sharps container.
Right, can I ask you a question?
Sure.
So you don't suggest starting with the armpit. You start with the leg for giving fluids, and then if we can't get it in there, then we go with the
I
armpit.
feel comfortable with both,
Okay.
but in the leg area, there's an easier opportunity to get just skin.
Yeah.
When you're in the wing pit area, you got skin, muscle, the rib cage there. You still can hurt the bird if they jostle and stuff, but it just seems to be, it's farther away from the air sacs. So, when you're up by the knee area, the air sac is all the way in underneath. You shouldn't be giving in the abdomen area because there is an air sac in there as well as vital organs. But yeah, when we inspect the legs, you'll see that the skin on the leg is just more plentiful. It's just a lot safer. And someone is going to be holding these legs, still in the body, so there's less likelihood that the bird's going to go like this or this and stuff like that. So the wing, the person giving the injection, they're the one in charge of the needle and the wing. So a bird flopping that way is going to be a little more risky. Pelvis and hip. Okay. I'm just going to, in short, x-ray. Okay? You can suspect a pelvic fracture if they have nerve response in the legs, but they're not standing. And you can't find any fractures on the femur, tibiotarsus, or tarsometatarsus, which we're going to go through now. Those are things you can feel. But if they're using their legs, there's nothing broken in the leg bones, I always go for pelvic fracture, which are very painful, so pain medications, but just making them as comfortable as possible. And then we can assess, just how much damage there is. A lot of times when a bird can't stand, they start to decline. They seem to have a gravity-fed digestive system that can't be messed up. Humans are the same, it's just like we do have to have some upright activity. But these guys, we've seen clogged vents, and the actual digestive system isn't breaking things down. You see like crystallized urine, so those urea crystals aren't completely being turned into the white stuff, the uric acid that we see birds urinating out. That's not the poop, it's actually the urates, but it stays in this like crystallized form, and it really grates them hard. We see birds die from not being able to stand up for long periods of time. So that's something that we also have to look into, is a protocol on how soon should they be standing before we make a decision that this is not going to be a good outcome. The first bone, the femur. So feeling the hip from behind, you'll feel like almost like a plate, smooth like plate to the knee. You're treating this the same way that you treat everything else. You're asking the handler to give you control of one leg at a time while they hold the other one. And while you're holding it, you're just feeling for the same things we did in the leg or the wing. The only difference here is there's a talon attached to the end of this extremity that can hurt you. So it's a little different, but you're still gently pressing, feeling for any popping or dislocations all the way down. When you get to the tibiotarsus and you start gently pressing, you should also notice a little, it's like getting your funny bone, or when they tap your knee, you'll get a reflex when you pinch right around here. Starving birds, it'll be very little muscle here. This is actually one of the first muscles to regain its strength in clinic. You'll see birds gaining weight but have nothing in their chest. That's normal. They're not working their pectoral muscles, but they are working their leg muscles, especially when they try to get away from you. Down to the tarsometatarsus, which is the last bone, and attached there are the phalanges. So I don't know if it'll catch up But when a bird's leg is fully extended, watch how the talon, it makes it a lot easier to manipulate those toes. If he gets into your glove, this is something you do. You extend the leg fully and they lose the gripping power. Because if you notice when you bend it back, what happens to those toes? They naturally, just because of the tendinous connections that are in the leg, this is the most powerful part of the raptor. It's pulling back in, they have more squeezing power. So that's why, when people like get more control and they do this, it's harder. Just extend the leg and pull straight out and they'll lose grip. Hawk, I don't even know what that means. It's the joint, I assume.
Can I take that off?
It's just one of those things where, yeah, we have a knee and then we have a hock. So the hock is just, I assume, the knee part between the tibiotarsus and the tarsometatarsus. Owls. Cool thing about owls is they can have 3 toes up front, or they can have 2 in the back like this, and they can change. And it's the P4 that is the one that goes. We won't go into counting toes. If we go to the phalanges and you say, oh, P1 is fractured, P1 is always the halix, and then you count inward toward the body on that. So for the left foot, it's going to be clockwise. For the right foot, it's counterclockwise. Levo, dex. So yeah, it would be 1, 2, 3, 4. 1, 2, 3, 4. The outer pinky toe that you would imagine is always P4. So if you want to label them, that's great. Get comfortable with that terminology if you like, but that's not necessary for this training. Foot pads. Everyone look at the bottom of your bird's feet. They should all be without wrap. Usually they're going to be a little dirty with poop after they've been in here for a while. So you're going to see some like brownish and blackish coloration. That's just from kind of stepping onto a pile of their own poop and then having it wipe off and that's why we have to clean these cages, so that doesn't get crusted on there. But what you're really looking for is, we don't want to see cuts, holes, any sort of wounds. Those are things that we need to treat immediately. It's a very, very serious topical treatment of that area. Antibiotics, the farther away from the body you get, the harder it is to get those, systemic antibiotics to those extremities. So we give not only oral antibiotics, but we treat this topically with very serious stuff. And then we'll do ball wraps, which would be another cool wrap to teach people how to do.